Today we're going to be talking about time management for the medical student. So buckle up and get ready to be motivated. All right, a while ago I did a survey for a bunch of students and a few professors at the university. And I'm going to review a little bit of the results with you. I only asked 10 questions. I expected that it would take no longer than 4 minutes to finish it, but I gave everybody 3 days to complete it. The result was that out of over 230 students, only 115 responded. So about 120 students, I can tell you, either they had technical difficulties or they can't follow directions, even though I told them you should be able to finish this in a few minutes, or they don't care. Now they may use the excuse I don't have time, but what I hear is I don't care. The first question I asked was basically how many hours of sleep do you get? And the responses were across the board, but I recognize that most students and teachers get less than 7 hours of sleep. Very few get more than 8 hours of sleep. On the bus, since they spend so much time on public transportation, so on the bus, what do you do? And most of the students either listen to music or look out the window. A few of them did take the opportunity to mingle with their friends. Some slept, even though this is the bus to work. So they had just woken up maybe half an hour, 60 minutes ago. On the bus from work, the same number of students that were talking to friends continue to talk to friends, but there's a noticeable decrease in the listening to music and looking out the window, and a significant increase in the number of students who sleep right after their work. So then I asked them, what do you do after you finished all of your lectures? And almost all of them went straight home. Very few went to the library, gym, or hung out with friends. So I asked a bunch of questions to try to get a description of how they feel about themselves. And when I asked them about procrastination, many of them admitted that they sometimes or often or always procrastinate. They like to make study plans, sometimes or often or always make study plans, but they tend to delay them. And almost a majority of them did admit to studying at the last minute. And many of them said that they felt like they were out of time. This is an interesting category, which is how many of them admit to having interruptions during their study time. And a majority, again, admit that they get interrupted at least sometimes. And then I figured that if they're not studying or if they're getting interrupted, then how much time are they spending with their colleagues? How much time are they socially active? And all of them said less than 3 hours. So I wonder where that time was going. When I talk about the distribution of your time, there's really 3 main categories. The first is going to be sleep. We're going to have to discuss how much time you spend sleeping and how valuable sleeping is to your academic success. The second is going to be how much time are you spending having fun, socializing, enjoying time with your friends. And the third is going to be how much time are you spending studying. Every one of these is important. And I can't tell you which one of them is more important than the other, but I will tell you that there have been some studies talking about each one of them. Okay, so the typical day, based on the results or on the data that I tabulated from the questionnaire that I gave, is that most students sleep about 7 hours. Most students spend a certain amount of time in the hospital doing their clinical rounds, learning, and those are about 3.5 hours per day, and then most of them spend 2 hours in the lecture. There is time for transportation to and from the hospital and the start of the lecture. But the rest of this, all of this here in blue, is everything else. And very little of it, obviously, is socializing and having fun. So we have 11.5 hours of non-clinical, non-sleep time daily. So let's talk about social life. When you're in college, we want you to party as much as you can. I want you to have fun. I want you to make memories. I want you to meet people. Oftentimes, the people you associate with will end up being lifelong friends. But when it comes to studying, we need to study more than you party. So however much you've decided you're going to party, just make sure you leave enough room for studying. Make that just an absolute rule for the way you live each day. So I'm going to use an example which is closer to me in terms of my specialty, and that's pediatrics. And the most commonly used book, or at least the book that we use in our college, is Essentials of Pediatrics. So I look at the table of contents for Essentials of Pediatrics, and I figure out how many pages there are. It turns out it has 756 pages in total, and about 2/3 of those pages are dedicated to the pathophysiology, history, and physical exam and differential diagnosis of each of the conditions that are in Nelson of Pediatrics, and 1/3 is the management. Now, in our college, the way we teach pediatrics is your first rotation, which is in the early clinical years, is one where we focus on the pathophysiology, history, physical exam, and differential diagnosis of pediatric conditions. And then you do another rotation in pediatrics near your graduation time, and that's when we focus more on the management, including the lab investigations and the treatment. So if you're an early student, you're going to be focusing more on the first 2/3. If you are a more senior student, then you're going to be focusing on the last 1/3. The 2/3 of 756 pages is about 500 pages. Okay, sounds like a lot. Okay, so let's divide that. Our clinical rotation in pediatrics is 10 weeks. Let's assume you spend 8 weeks studying and you review for the last 1 or 2 weeks. And I say 1 or 2 weeks because I actually recommend review only for 1 week and then relax for the week before your exam. If you do everything right, you should be able to do that. So if you have 8 weeks to finish 500 pages, that gives you about 63 pages every week. So you're only asked, or you would only have to do 9 pages per day of studying in order to complete the entire Essentials of Nelson, to complete every single disease and topic on there, many more than you'll be asked about on the exam, and you will ace pediatrics. You can do a similar calculation for any one of the other subjects. Pediatrics tends to be one that students often complain about not having enough time in. If you want to be a ideal scholastic #1 type student, just read 13 and a half pages per day, which is the entire 750 odd number of pages divided by 8 weeks. Or you can focus on studying the 9 pages per day that are that you would need as a junior medical student, or one who's only focusing on the pathophysiology, history, physical exam, and differential. You'll be able to make those calculations on your own, figure out what kind of student you want to be. If you study everything from the get-go, then when you become a senior student, it'll become even easier for you, and it'll be just doing a matter of review. And if you follow these principles, you'll essentially complete the book in 8 weeks. And then you'll still have enough time to review prior to the exam. And just review. You're not studying, you're not memorizing, you are not stressing. It is going to be the easiest exam you've ever taken. And if we look at the data that I tabulated from before, if you remember, we saw that one of the worst issues that students had with their studies is that they often were getting interrupted. So if you really want to be able to finish your 9 pages or 13 and a half pages per day, you're going to have to figure out a way to not get interrupted. And I'm going to tell you now, there's only one way of doing that. Sure, I want you to choose a quiet area, and definitely no background TV. But the worst thing that students are often doing is they have their phone next to them. It rings, it dings, it bings, all of these little notices that come up that tell the student, hey, look at me, leave what you're doing. And once you leave what you're doing, it's going to take a while for your brain to get back into that mode of being able to study again. Definitely no visitors. Have a little sign outside your door. Nobody come in, study time. Your parents will love it. Your fellow students are going to understand it. There's no reason for you to not dedicate a certain number of hours per day. And every one of you needs a different number of hours to finish your 9 pages per day. Figure it out. And that's the time that you're going to dedicate for studying. Now, you certainly have enough time during the day to do a lot of this studying. You're not going to study during the your sleep time, and you're not going to be able to study during your clinical rounds, although paying attention in clinical rounds will make a difference. But you might be able to figure out a few places where 10, 15, 20 minutes is going to make studying amazing or easier. Just before the lecture starts, instead of sitting around and, looking out the window, or like we saw on the bus, just listening to music, listen to music and prep for the lecture. It's just 15 minutes, 20 minutes. It'll make that lecture stick to your mind much, much easier. And it'll count towards the number of pages that I'm asking you to review each day. Make your lectures, instead of them being 2.5 hours, instead of them being 2 hours each, they're going to be 2.5 hours. And that'll give you a total of 6 hours of studying per day. I remember the data that we saw earlier with when I asked the students what they do on the bus from work after they finished working. So many of them are listening to music and looking out the window. Oftentimes they're sleeping because they haven't gotten enough sleep. So that's wasted time during the daytime. We'll fix that later when we talk about how you should sleep. These are excellent opportunities for you to spend a few minutes studying, reviewing. You can review in the Essentials of Nelson. There is often a page at the end of each chapter which summarizes the pearls that are required of you, and just looking at them, you might be able to skim through them in 10 or 15 minutes. We're not asking you to memorize, but this is preparation for the lecture. So when the lecture time comes, you sort of can follow with the professor a bit easier. You could watch some YouTube videos, and there are some amazing authors out there who produce some amazing videos that make really the learning of medicine much easier. One of whom I found is great is YouTube Osmosis. I'll leave a link down below so you can do it, so you can watch it. Another group of videos are great, also by Armando. I'll also put a link down in the description for these videos. But these videos offer a short way of reviewing some complex subjects, and you might want to spend your time on the bus watching a few of these. There's lots of other websites. I'll leave some links down in the description that either give you cases to review or even just MCQs. But if you don't like reading on the bus, and everybody's different, some people get car sick, then wake up half an hour early and prep for the lecture. Watch a YouTube video while you're getting dressed. Just leave your phone on, or leave your iPad next to you while you're getting dressed, and read during the bus to work. Prep for the next day 30 minutes before going to bed. Figure out when a good time for you to prep is, but use a good time to prep. And I suggest right after your lecture to go to the library. And maybe you can spend an hour and a half at the library. And that'll add to the amount of time that you've spent studying. And it still takes us to only 8 hours total of work. If you don't want to do the 2 hours in the library, you can do 1 hour in the library and then 1 hour before going to bed. Again, another option, 2 hours before going to bed. But I do not want you spending the time sleeping in the lecture. Because if you sleep in the lecture or you're not paying attention, it's the same thing. It basically takes 2 hours away from here. And you're going to have to make up for it later. So it's much easier to find a way to stay awake, pay attention during the lecture, so that you don't have to spend that much time trying to catch up later during the day. And so how can we be sure that we don't sleep during the lecture, that we actually get a proper amount of sleep? And we'll talk about that in a little bit. So I'm going to give you an example of one of the chapters in Pediatrics, which is often considered one of the more difficult chapters, which is fluid and electrolytes. In totality, it's 19 pages. And if you're going to do the 13.5 pages that we discussed earlier per day, then this is going to take you 1.5 days. But if you pay attention during the lecture that we give about fluids and electrolytes, that replaces a full study day. And so you only have to spend half a day reviewing the lecture and reviewing the chapter rather than studying it from the get-go. And if you've prepared for the lecture, then if you know that there's something in the lecture that you don't quite understand, then you'll be able to ask your professor or send an email or send a WhatsApp message asking about clarification. If you do that during the rotation, it is much, much better than trying to run to the professor 2 days before your exam and telling them, I don't understand this, I don't understand that. You will lose a lot of respect if you do that. Let's figure out when is a good time for you to study. And every one of you is going to be different. Some of you feel most productive during the early morning, some of you before bedtime, some of you after lunch, some of you can never study after lunch, some of you after the gym. Figure it out. Be honest with yourself. Tell yourself, I'm most productive during this time, and dedicate that time to adding to your study schedule. If you are the kind who gets bored when you're studying, you should know yourselves by now. You're in med school. You should know how to study. But if you get bored studying, then figure out a way to make it fun. Group study can be great. Drawing pictures. That's what Armando does on his YouTube videos. Make a YouTube video about the topic that you're studying. Pretend like you're teaching it to somebody. Get with a group of friends and tell them that you want to teach them this topic. Teaching is the best way of learning. Make questions. Pretend you're a professor and you're going to make an exam. Try to figure out what it is in that chapter that is required knowledge. Write a question about it. Share those questions with your friends. Those are excellent ways of trying to make studying more fun. Study during wasted time. Read notes during lunch or dinner. There's so much time you can figure out during the day. In the end, you'll complete the book in 8 weeks, and you'll have a nice 2 weeks prior to the exam where you can just relax, review, and you'll feel great. And you will ace the exam. We said party as much as you can. I want you to study more than you party, but I want you to sleep more than you study, period. If you sleep enough during medical school, then you'll be able to stay awake during the lectures and during your clinical rounds. And if you stay awake during the lectures and clinical rounds, I guarantee you will pass. You won't get flying colors because you haven't studied, but you will pass. So sleep will let you pass. If you study the 9 pages per day that I'm telling you about, you will do more than just pass, and you will ace. Sleep loss leads to a variety of things, including physiologic problems like immune dysfunction. Weight will increase, stress, cortisol levels increase. But the one we're going to focus on is the fact that it lowers your academic performance. Sorry about that, square in the wrong position. So on the bus home from work, 20% of the students said they slept. And the only reason they slept on the way home from work is because they haven't had enough sleep overnight. What is enough sleep? 8 hours of sleep. And how are you going to get your body used to sleeping for 8 hours? Avoid stimulants before bedtime. That includes caffeine and nicotine and alcohol. Get yourself a nice, comfortable bedroom, whatever your comfortable pillow is and comfortable comforter. Make sure it's quiet, it's dark, and it's got to be cool. Make your bedroom or your bed used only for sleeping. Don't study in bed. It's a bad habit. And good sleep hygiene also includes having a consistent sleep schedule. Sleeping on time and waking up on time, including the weekends. You have to nap early or not at all, and do not eat any heavy meals just before going to bed. Again, 8 hours of sleep are recommended. So if we do a new schedule for you, it's going to include going to bed at 11 o'clock and waking up at 7. And that way you'll be able to party as much as you can, study more than you party, and sleep more than you study. Sleep, most important. I need you to get 8 hours of sleep. Change your schedule around your sleep. And then study every day. Your goals are going to have however many pages you think you can finish per day. You're going to need to study at least 9 pages per day. And that leaves you 2 weeks for review. And then really, really enjoy your free time. Thank you very much. If there are any questions, you know how to reach me. And we'll see you again in the next lecture.